My first experience with you was when I turned up on my own and very frightened at my first appointment after diagnosis. A lady with a hospital lanyard came across and introduced herself as a clinical nurse specialist and would be supporting me through my entire journey. I could have cried with relief.
From initial tests and diagnosis, through treatment, and now post-treatment reviews and follow-ups. They are the comfort blanket that helped us to deal with the most challenging time of our lives.
My CNS explains things clearly and gives me hope. I trust her 100% and thank her for always being there.
How I started my role was I was in the middle of a psychology degree, and to make some money on the weekends I used to clean on just one of the wards, and when I was cleaning I naturally just used to gravitate towards patients if they needed help with their food or if they wanted a chat, and I thought I absolutely love this. So I went to become a healthcare assistant and from there wanted to do more. So I went back to university and trained to be a nurse on a cancer ward. I was lucky enough to then be interviewed and get the job of a cancer nurse specialist. You know, there are obviously really sad things that happen in our job, but it might be that you get someone that comes in and just smells like your granddad and it just hits, and you just need to take yourself away for a moment and have a cry in the toilet or have a hug with a colleague or just sit by yourself and collect your thoughts and then go back in the room, and that's okay. So an example of someone that I've helped that stays with me, a lovely lady called Jenny, obviously not her real name. Jenny came when I was relatively new into post with a very, very aggressive lymphoma. And I remember meeting her on our non-cancer ward and she hadn't been told yet. I was the first to deliver that news to her, and I just remember sitting by her bedside and seeing the fear in her eyes and just holding her hand. And she didn't care about her at all because her main concern was out in the garden, and it was her 3 lovely children. She ended up getting into a complete remission, which is fantastic. And last week she came back into clinic to be discharged after a 3-year point, and she gave me this lovely card, just a message to say how the little things had saved her life as well as the big things. And I think that's something that you forget in this job, the impact you can have and the impact that they have on you. And when your day isn't going well or you don't think like you're giving enough, it's a really nice reminder that the little things are just as important as the big things.